Okay, so this is a special edition of our podcast, When Doctors Have No Answers. And I'm with Dr. Tom Giammatteo, who is a doctor, a chiropractor, naturopath, co-developer of integrative manual therapy, and one of my longtime friends and teachers. And he's in the East Coast, West Hartford, Connecticut. I'm on the West Coast, Bellingham, Washington. And today I want to ask him about the idea of stretching versus not stretching, because been working with a lot of runners lately, and they see me and my son, the one that's in track right now, with a very good stride, like wide open stride. And some of them think it's because we stretch, but there's a different way we think about the body with integrated manual therapy. And I want to just have a short conversation with Dr. Tom Giammatteo about the idea of stretching, not stretching. We have this reflex arc idea, and integrated manual therapy has a different way of thinking about how to help the body loosen up or optimize function. Tom, so good to see you and welcome.
Hi, Ralph. How are you?
Very good, very good. Yeah,
thank you a lot. So flexibility coming from long strand stretching, which means you get into pain, and versus using a counterintuitive technique called strain counterstrain, right? So we've both been physical therapists for such a long time, and we learned about the neuro input system of the body and how it works. We actually take the tissue into the shortened position. So if somebody needs to stretch their hamstrings, we're actually bringing it up so that it bends to its easiest position. And there's a lot of neuroscience on how that resets the mechanism of the muscle guarding. So we have two types of stretching. We have the stretch where you put it on at its longest point, and you're hoping for plasticity, which means the muscles and the fibers start to stretch, just like if you took a ring of plastic, when you get a 6-pack of Coca-Cola or something like that, and you keep pulling it, if you pull a little bit, it bounces back. But if you pull it for a long time, it gets some plastic movement to it.
And I got a short story about that.
Yeah.
In physical therapy school, something happened that made me just go, what? And they were talking about stretching and how you had to hold the stretch for a period of time, like 30 seconds or 45 seconds. And they showed this little curve. And they said, if you stretch for less than that, then it just comes back to the regular length. But if you stretch past that, then it goes past it and it won't go, it'll be stretched out. And I thought, but that sounds like a rubber band. If you stretch it too much, it's no longer a useful rubber band. You just kind of stretched it out. And I still think about that moment. So that idea of stretching for a long time to stretch something, what does that do to the body when you do that?
If you do it too quickly, you're actually causing micro tears in the whole system. And over time, you're causing micro injuries to the area and stressing it out. So what we try to do is take the guarding of the muscle out of there, so the muscle, if it wants to untangle, can untangle with a little bit of suggestion instead of having this, and it feels like butter instead of having these steel bands that pop up.
And then it's an optimized muscle that can function better too.
Yeah.
There's this whole principle of when the doctor or the therapist takes the little reflex hammer and taps the patellar ligament, it stretches it real quick. And then the result is the muscle, the quadricep contracts. Can you talk about that reflex arc and the idea of stretching and can you override that? What happens? You talked about that things can tear. The body seems to want to protect you from stretching.
Yep. So if a muscle gets tight again, Ralph, and we've had cramps in our calf muscles, Charlie horses, right?
Yeah.
And some of them we just rub on them for 5 minutes and they get better. So maybe that's a poor microcirculation and the muscle has to shut down. And when you feed it with blood again, the flexibility comes back. And the next day you don't really feel sore there. So that muscle is maybe saying, hey, I'm not getting enough blood, so let's seize up so we can catch up on that. Let's take a pause. And other times the Charlie horse hurts and you feel it for days. Maybe that one you've actually, you may have gone up too much of an incline and you've torn it a little bit. So you've actually caused this tissue damage, and the reflex is, oh shit, I gotta tighten up so I don't rip anymore. So those types of lack of range of motion, where you stretch it and it's flexible and 5 minutes later it comes back, or 3 days later it comes back to be tight, is a possibility that muscles are doing their job. Somebody in the body is asking that muscle to contract, and it takes a lot of energy to do that at the same time. So I'd say
Yeah.
muscles are stupid. If the spasm comes back or if the trigger point comes back, then there's somebody else it's something else in the body maybe needed to protecting. So if I can't bend my head to the side or the other side, maybe there's an artery or vein or nerve that we're actually tearing a little bit more, and the muscle keeps us from getting there. So
You know,
even tight hamstrings, we've seen this in our practice for over the last 30 years, is if after we reset the hamstring muscle with either strain counter strain or tendon release therapy, they're able to touch their toes. So optimal human precision is almost like the yoga instructor. You should be able to bend over or touch your toes or put your head between your knees as flexibility in that whole process. So overstretching over time, we're using the plastic motility of, pulling it, but that plastic ring of the Coca-Cola can is weaker than the plastic that was in a complete circle before, right? So we are
yeah.
damaging over time.
So for, I know, some runners have, I see them doing it and hear them talking to me and asking about it, and they're asking about stretching, because I think that's the key is, what would you tell, say, a little, high school, or say a high school runner that, can't touch his toes and he wants to improve his running, but he thinks he needs to stretch. How would you talk to those guys? Because I'm running into those guys.
Yeah. I would take them aside and say, take 3 minutes and do it this way and see how much more flexible you are. We use the advanced strain counter strain system to do that, where they relax, and you really can't relax on your own. You need somebody to take you into the position to reset these deeper neurological pieces.
I
They
think
need to
that's
be,
the key, just to test it for yourself. That's what
yeah,
got me IMT was, I took that first class on the pelvis, men's and women's health issues back in 2000. And my running that week felt so good from doing real simple, not simple, but very gentle techniques to work on the pelvis. So that would be a good thing just to test it for yourself.
right. And to, what was surprising to you taking the classes, you didn't even work on that leg much,
Not
and
at all.
everything together calmed everything down.
Yeah, my form was so much better. Everything was popped up.
Yeah.
I was moving better. But that course, we worked on the kidneys and the ureters and the bladder and the prostate and little techniques. I had no idea you could do these things to those techniques, to those areas. But my whole body unlocked, and I was running with better form. So that's what sold me. And I do have that story I've told over and over again about when I had the calf problem that spasmed and I couldn't run more than 5 minutes. And I tried lots of stuff for 8 months and finally went to an integrated manual therapist. And she literally said I had a problem with my heart. And she did some gentle techniques for the heart and the aorta and did all these things called the diaphragms. And I thought, I think I can run. And so I tested it 2 days later and I was back to running. And she never worked on my calf. So my calf was spasming to protect something way up here, which seems incredible to most people. But
Right. So there's the other story of where the pain is not the problem.
yeah,
So I had a new evaluation today. A man went blind in his eye. It's called hypertrophy of the optic vein. And he's a 51-year-old, hasn't used chiropractic or acupuncture or alternative medicine. And he called me like 3 days after this problem started in August, and it took him up until now to get back in. And the doctor said, well, this happens, that the vein inside the back of the eyeball pops open, and therefore you lost your vision. And he did rest, and they did some steroid injections in there. to figure out what's happening to him. And, they put him on a cholesterol lowering medication and, scared him about his vision. I had suggested a behavioral optometrist that looks at the eye slightly different than traditional medicine does to the area. So over time and rest, he's gotten his vision back 80%. And he came in for the evaluation today, and we did our mapping and found out that the whole right eye looked like, it had lots of structural adhesions to it. And when I tried to move his face, trying to glide his eye one direction and the other direction, this felt like a solid rock. And I went through and said, and his optometrist assured him that the front of the eye doesn't have anything to do with the back of the eye. And his contact influence doesn't. So as we're peeling the onion away, it was like, well, I want to monovision, which means I have one contact to see far and I have one contact to see near. And it's about 4 months between that happening.
Whoa.
And his optometrist said, oh, there's no such thing that those two things are related, right? In your head there, you're finding like 12 different things that could be optimized there, right?
Yeah.
So, I said, I'm not sure if you're going to believe me, but, we found this tight, your heart tight, your posture is poor. And if we get all those stretched up, you'll have more flexibility in your eye and you should see better. So I sent him back to the doctor because he has 2 contacts in. And I tried to do the vision chart with him, and he was reading better because his right eye was for the long distance and his left eye was for short. So he was blurry because of his contacts. I said, well, go get a reading of how much they're off and let's see how much we can improve these things. So
that's so cool. Yeah, it is a
right.
matter of tests.
So,
and stuff
yeah.
for these.
Going back to the same thing with hamstring tightness. If you've always been tight, there's a problem that hasn't been released. It could be, when kids are young in males, especially, there may be a descended testicle or lots of bladder infections. So those can make the hamstrings tight and everything else.
And I've got, I get the privilege of working on my son because he's in cross country and track, and he loves me working on him because his running form gets better and better. And was hurt quite a few years ago. We had to go get stitches for a big injury to his forehead. And he was saying how when he breathes, sometimes he has a pain there. So I thought, well, let's test this. We tested his hamstrings and it was tight on one side. And I did a little of what we call the myofascial release, the IMT approach. And then his hamstring improved. And then another time we worked on a bone bruise in his right upper arm and the hamstring improved. So we are like this 3-dimensional bodysuit, and the tug, the problem could be coming from someplace far removed. And that's why it's cool to get the mapping and feel it. Tom, I know you got to go and I've got a big meeting. So I just want to thank you for this. And if you want to talk to Tom, IMTwellnesscenter.com in West Hartford, Connecticut. And your phone number again, Tom?
860-561-2286.
Thanks. And then Bellingham, Washington, ralphhavens.com, 360-599-2217. Reach out to us. We can let you know what we see that's going on for you and your health. And just know there is an answer. If something hasn't worked for you, it just means you maybe haven't found the cause of it. So I'm going to sign off now and hopefully talk to Tom for a second, and reach out to us if you need anything.
Happy holidays, everybody.
Yes. Happy holidays. Thank you, Tom. Let's see. How do I do this? Turn that off.